My name is Shani John. I'm a physiotherapist. I have been practicing in this field for about 18 years now. And at the moment, I'm doing like a consultancy physiotherapy, mainly home-based, as well as I do help at the hospitals, both government and private hospitals as well. Physiotherapy covers most of the field like cardiothoracic, orthopedic, neurosurgery, as well as abdominal and gynecological surgery, because each part of post-op recovery, mainly physiotherapy, is very important. When you talk about post-operative patients, mainly they are bedridden, like they are in the bed for after the surgery, like we will say about 48 hours to 72 hours, and they are not moving much in the bed, or they are not coming out of the bed. So when you talk about a person lying in the bed for more than about 6 to 8 hours, the chances of getting complications are higher. So it's very crucial, we would say, on the first day itself to start mobilizing them out of the bed. Physical therapy mainly helps to maintain their physical mobility, like getting out of the bed, doing their breathing exercises for the chest, helping them improve their balance, as well as helping them with the walking. Whereas occupational therapists mainly does, they actually improve their quality of their daily living activities, like taking a shower. So basically they deal with activities of daily living. The first and foremost thing we come to the patients is first is their ankle pumps, or we say as a foot pump. So basically that is just moving their feet up and down, that helps with the blood circulation. And the second pump is the heel slide. So basically like moving their heel on the bed, bending their knees and straightening their legs. As I mentioned, when they are in the bed, their chances of getting cough and secretions, the chances are very higher. So what we usually teach them is deep breathing exercises. So if like they didn't have any problem with the shoulder, we usually teach them together with the upper limb, taking a deep breath in through their nose and blowing out through their mouth. Then the next will be we call as a splintered coughing. Mainly this comes with cardiac patients as well as abdominal or gynecological surgeries. Because of the incision, most of the patients are worried or they are anxious to cough because it's quite painful. So we usually teach them how to splint their incision area by hugging up a small pillow and then coughing out, so that actually helps them to ease the pain as well. Most of the patients have difficulty getting out of the bed. They are not very sure how to get out. So usually coming out of the bed, we will teach them first and foremost thing is to bend their knees, roll onto the side and use their legs to hang it out of the bed, and push on with the hands to get out of the bed. So it's good for their posture and back care as well. Post-op cases are mainly very important, as like an old belief, people think that when they have an operation done, it's not good to move out of the bed. But now like as people have experienced it, the early they mobilize, it's actually good for their healing as well as help with the recovery. So some patients can't be able to walk, it's fine, they can just do seated exercises, but they can still progress with some simple bed exercises that help them to recover faster. As you know, when we move, our healing gets better as well as our recovery is much faster.